So after the lunch time, all doctors are in a park avastha. So disturbing your sleep. My third presentation, fistula, laser in fistula. So laser in fistula. Fistula laser closure, that is called as FILAC. It is a sphincter saving technique, no incontinence risk, destruction of the fistula tract and additional collapsing tissue, and easy and time-saving procedure without excision. So indications of FILAC, that is fistula laser closure, that is transsphincteric anal fistulas. Anal fistulas in patients with low sphincter anal tone, and cases of multiple recurrences, that is Crohn's fistulas, and patients already treated with loose atoms are